I'm a recovering radiologist. So what that essentially means is I kind of changed careers. And I got tired of sitting in rooms and reading stuff because I like to integrate myself in with patients. And first of all, before I even get started, I want to thank this man, Dr. Harch. If not for the work, because in truth, there are some sentinel moments of our lives when something happens. It's like the 5 people you meet in heaven. You have some irrelevant contact with somebody, it changes the trajectory of your life. And when I read about Eden Carlson, I was doing regenerative therapies in my office, and I was doing primarily musculoskeletal conditions. And guilty of all the things the FDA doesn't like, right? So I did fat and collagenase, and I did bone marrow. And then I heard a lecture about 3 years ago, and it reminded me of when I was in med school. When I was in med school, I don't know, about 28 years ago, 30, something like that, maybe 30 years ago, I heard a lecture about epigen. Everybody remembers the blood doping, Lance Armstrong, and all that stuff. So I heard it. I was a first-year med student in the State University of New York, and he looked at us and he grabbed everyone in front and he said, listen, I want you to take $10,000 out of your pocket and put it in epigen. You're going to be a wealthy man. And I looked at the kid next to me, and he had no money. I had no money either. And we laughed, and for 10 grand, we'd all been millionaires in like 2-3 years. So 3 years ago, I was sitting just like you are in a lecture hall at a regenerative medicine conference. And I heard my now partner and very good friend at a place called Chimera Labs, a PhD named Duncan Ross. He's a PhD in immunology and biochemistry. And that's really weird. To see somebody has those 2 backgrounds allows somebody to both grow cells and separate cells, and that proved extremely useful. And I heard him give a talk, and he talked about the regenerative capacity of not just stem cells, but stem cell products. And bulbs went off in my head, and I said, wow. I said, that's penicillin. And I flew home. There was a Zika outbreak in Miami, and my wife was pregnant with one of our kids, and she couldn't fly down with me. So I flew back, and I'd been gone 2-3 days. She goes, oh, I'm so happy to see you home. Listen, honey, I got to go back to Miami. She goes, what are you talking about? I said, I saw something that's going to change my life, and I believe the lives of my patients. So with somewhat of an argument, I got back on a plane. I brought my checkbook, and I bought a bunch of product. And I stayed for 12 hours, and I learned all that I could learn about exosomes. Over the next few years, I've read more than anybody, and the protocols that I've set up are not just for CNS diseases, and we'll talk about all the stuff that I've done, mostly with brain injuries and spinal cord injuries, but with Parkinson's and MS and other things, and it's kind of meshed into different areas. I do autoimmune disease, I do musculoskeletal medicine. Can I say that I do ED in a church? I guess so. I do ED and I do hair, and we'll share some of that stuff with you. But when I started looking at the medicine, after I heard what Dr. Harch had done, and I heard what happened to Eden Carlson, I started to question some of the basic posits of medicine that were shared with me as a physician. Posit 1, once Christopher Reeve, always Christopher Reeve. Not true though, right? Because we have examples now, myself and Dr. Harch, where kids and even adults in really horrible conditions start walking and cognating again. Supposedly impossible. So how is that possible? So he opened the door for me about epigenetics, so I'm going to take the lead a little bit. Before we get started with this talk, and hopefully we're getting close to being queued up, we are? Let it rip? All right, we'll start with some slides. So I want you to realize that when we're a 2-day-old blastocyst and you're in mom's belly, or you're 95 years old, your DNA code is exactly the same. What changes? Well, you're in utero, you've got to build a liver, you've got to build kidneys and eyes and ears, and then you're born, hey, you don't need a second liver. So you turn off those portions of DNA. Then you get a little bit older. You've made your lungs, your brain is fully developed, you turn off those progenitor cells. All these stem cell terms mean is as you age in utero and as you get older in life, the stem or progenitor cells throughout your body stop becoming full stem cells. Totipotential, they can turn into everything, even birth tissues. You get a little bit further after the first trimester, you can't form a placenta anymore because you formed that already. So you shut off portions of your DNA. Then by the time you're born, the multipotential, those cells, theoretically, in a petri dish, could turn into cartilage and nerve and skin and bone. And a petri dish, we could drive them down to different cell lineages. Unfortunately, that's not how it works in our body. So when you go out of country to get stem cells, or you buy allogeneic cells here, those cells, we no longer believe engraft on tissues and become cartilage, or nerve, or brain, or spinal cord, or any of that stuff. But some of these people get better, right? Yeah, they do. Because there are signalers that are sent out of cells. Let me give you an example. Everybody had a viral infection? Everybody's had one viral infection, right? So a virus works by going into your cell and taking up the cellular machinery. And then it sends out thousands of viral particles, little virions go everywhere, and then they infect every other cell of your body. Well, if you didn't fight it off in this cell, every sequential infection in your body would kill every cell and the organism would die. But that doesn't happen. By the time this cell gets infected, little information packets have gone off the first cell and have been received in the second cell. Those little paracrine bubbles, or extracellular vesicles, contain information that prevents this cell from dying from a virus. Those informational packets are proteins, but also protein factories. If you ever get PRP injections for your hair, you got to go back every 2 weeks. Why? Because the proteins get denatured in your body. Protein factories last for a month or more, and each protein factory can kick out 1,000 proteins, and the proteins are the signalers. This brings me to my second point that Dr. Harch spoke about. He talked about changing the profile of some of your nerves and some of your DNA. What does it mean? Well, imagine that we weren't stuck with these end cells, but rather we can wind them back and make them younger versions of themselves. He talked about the DNA being tightly wrapped with histone proteins and methyl groups. What if you could take those off your cells? You think you'd have younger cells because you had younger DNA? They would act differently. So, in difference to what they told us in med school and what everyone told you when you go to your regular allopathic physicians, there's at least 3 areas in your brain that can still form cells. The subventricular zone, just below the ventricles. Dr. Hart showed you examples of a baby's ventricle system, soft tissue forming outside of it. There are stem cells, progenitor cells that are ready to become neurons, ready to become glial cells, which are the supportive cells in your CNS, sitting right below the ventricles. Those are those fluid-filled areas in your brain you showed this morning. They're also in the subgranular zone, areas of the hippocampus, and even in the hypothalamus. So in your brains, and they've done post-mortem studies. They've looked at people in their 9th and 10th decades of their lives. That means 95 years old. People die, they section the brain. There are still primordial cells in the brain tissue waiting to turn over. They need coffee. And whether you use hyperbaric oxygen or stem cell products called exosomes, we're the best Starbucks you can get your hands on. Me and Dr. Harch right there. You have 2 choices with stem cells. You've got stem cells for you, from you, and your body won't reject those, but my stem cells are 54 years old, and we've turned off a lot of different alleles on my DNA. But my body won't reject it, so people are still harvesting fat and taking bone marrow. On the other hand, who banks their cord blood? Nobody banks their cord blood? Nobody banked their cord blood? Come on, somebody banked their cord blood. First of all, if you have cord blood, you've got primarily hematogenous stem cells. Cells that will form blood products. Very little MSCs. In Wharton's jelly, you have more. But if you take blood from somebody else and it's not matched blood, meaning your HLA alleles are not completely matched, you got about a 10% chance of a severe reaction. It's a graft versus host reaction. And the reason is, there's T cells in that stuff. They're naive T cells that have never seen foreign material, and you're foreign to that allergenic blood. Also, if you're unfortunate enough to have a sulfur allergy, you can have reactions to DMSO, which is the way that you keep blood cells in frozen areas. So, the forefather of MSCs, or mesenchymal stem cells, was Arnold Kaplan. And he called these mesenchymal stem cells because in a petri dish, we can turn these down many different cell lineages. Unfortunately, when we put them in you, it doesn't work that way. They stay for a little while, and they traffic away. Now he wants to call them all medicinal signaling cells. Anyone want to posit what the signals are? Little exosomes and microvesicles. So I use this as an example of how things work. Everybody's heard about plasma therapy here? Okay, so plasma therapy. We go into a place and we can go into like Alcahest or Ambrosia on the West Coast, and we can sign up and get 20-somethings plasma. Well, there's risk factors with taking somebody else's plasma. But what is that based on? That's based on these rats. Heterochronic coupling. You take an old rat and a young rat, you skin them, you suture them together, and you let them run around for 3 months. And then for their problems, they euthanize them. Interesting. The older rat will start looking younger, and the younger rat older. Phenotypically, they change. So what is it? Do we think they're sharing stem cells? No, there's not very much stem cells in your circulation, but in fact, the stem cells in your body are pericytes, and they live on capillaries, and they secrete right into the fluid highway of your body known as your vascular system. If you give somebody else's plasma, you get a very dilute broth of exosomes. So what are microvesicles or extracellular vesicles? When cells speak to other cells, they speak by a term known as paracrine signaling. So they send out proteins and messenger RNA and microRNA that turn certain aspects of your DNA on and off, but they do that within little lipid bubbles. And these lipid bubbles get released from cells and get picked up by other cells. They do some really cool things that you can't necessarily do with stem cells. If I give you stem cells, they're going to get lodged in your lungs. They can clump anywhere. You can react to them. You can have some untoward allergic type reactions from some of the things that they're baked in, like DMSO. These things, and I'll show you a picture, cross the blood-brain barrier even, much better than stem cells that were given intravenously. I'll show you other applications, both intranasally and intrathecally, how I introduce these into the central nervous system. They're not going to transdifferentiate into other cells or cause cancers because there's no DNA. These vesicles are just too small. One of the important things that we heard about today, and Dr. Harch talked about it a little bit, is the inflammatory nature of what happens in the central nervous system. They have actually tagged the macrophages of your CNS, the phagocytic cells that eat up debris. And they've looked at people after strokes and spinal cord injuries and the like, and they've tagged these cells, and they've gone out 2 decades, and they see inflammatory cells still kicking around. And that's one of the theories behind neuropathic pain, is yet you have an injury to the right side of your brain, a decade later you can pick up these cells on the left side in the middle of your cervical spine. We're missing something, because we tell you, well, inflammation is like the foot. You twist your ankle, it swells up, it gets better. This is in Brooklyn, it doesn't work like that. One of the things that mesenchymal stem cells and stem cell products do is they change the polarization of your cells. T helper cells fight infection, but they're very bad when you're trying to get rid of inflammation. They make them into T regulator cells. Hyperinflammatory macrophages get turned into tolerant macrophages. So they're changing the inflammatory milieu. What else do we learn today that changes the inflammatory milieu? Hyperbaric oxygen. When you look at exosomes on the market, I just want to point out, 3 years ago when I started talking about these, no one had even heard of the term, and I got these scant, distant looks from people and doctors who I was teaching. Now everybody on another corner wants to set up an exosome company. Umbilical cord Wharton's jelly, you're going to get all the other cells that are in there, mostly hematogenous stem cells and the like. Amniotic fluid exosomes. You'll see these, and your doctor will try to sell you those in the clinic. I will tell you there's 40 stem cell colonies in every 250 cc's of amniotic fluid. You're getting epithelial cell and fibroblast cell exosomes, but that's not what you want. You want mesenchymal stem cell products, preferably placental ones, because you want growth and anti-inflammation. Those are the sentinel things you need to recoup your neurologic deficits. Bone marrow. Well, there's some Jesuits that come after me and call me a heretic because I'm using exosomes and not your body's own bone marrow. Well, guess what? When you're born, one of every 10,000 cells in your bone marrow is an MSC. 1 in 100,000 by the time you're 20. Now I'm getting close to 1 in a million. So these are things that the buyer should be aware of. This is mostly for doctors. I put this in there. I use everything, and all of my studies have utilized Chimera exosomes because they're sterile, they're safe, and they've been dosed over 25,000 times. The company is taking this to an IND for 2 relatively innocuous conditions to those of you here today. Craniofacial neuralgia, which is an atypical facial pain, and keloids, because they want a safe transit through the FDA, and everybody's given kind of a safe pass until November 2020. So I've been attacked in some of these groups by saying, well, exosomes are empty cargo, and these are empty missiles. Somebody spoke about a symphony today. And what I mean by a symphony is when I introduce exosomes, I'm playing the first few bars. What I want to do is get all the other cells, the astrocytes, the microglia, the oligodendrocytes, the neurons, to play their own music. These little animals are sitting in their own neurogenic niches quiescently, waiting for somebody to play music to them. Why else would these kids be waking up? Because the stem cells are there. When I see changes, by the way, after treating people for the last couple of years, I noticed some very early changes that I know are due to decreased inflammation and are probably secondary to the release of proteins. That usually happens within days or a week or two. Somebody will have Alzheimer's. My friend Tony's wife calls me about 12 days after treatment. She goes, Doug, you never guess where Tony is. I said, where's Tony? She goes, he's downstairs. He had a stroke 15 years ago. She goes, he's downstairs. He's looking at his safe and looking at all his stuff. I said, is that unusual? She said, 15 years ago, he forgot the combination. That is improved neurotransmission. My friend Jim Davis is here in the audience. Jim, raise your hand. He's a physician in Texas. If you can't slum it up in Jersey, he will help you here in Texas. Marcella Madera was in earlier. She also works in Texas and does many of these same procedures. This is what started me. This is what started me out of regenerative medicine, thinking only about musculoskeletal injuries. If I didn't read this article, I wouldn't have thought it was possible because I didn't believe. I thought we were ruined. I thought if you had a stroke or you had a brain injury, I thought we were done. I was told that in med school, just as you were. And then I pulled this article. That's what started me down the road. You're turning on all their stem cells, sir. I do a lot of spinal cord injuries. And when spinal cord injuries occur, the first thing to go is usually the gray matter. The gray matter goes, and then things go really sideways. You get inflammatory changes, you get spinal shock, you get neurotransmitters firing, you get runaway inflammation, you get oxidative stress. When's the last time you heard an allopathic physician talk about oxidative stress? Who does intermittent fasting? Let me see a show of hands. No, I know there's a healthier crowd than that. No one here does intermittent fasting in this section? There you go. Anybody know why you do intermittent? Thank you. Anyone know why you do intermittent fasting? You stop taking in glucose, so your mitochondria that are powerhouses of your cells don't need to continue to produce ATP. When mitochondria, the little powerhouses, produce ATP, they release free radicals. Those are known as oxidative stress. And you have little chemicals in your cells that help bind free radicals. It's not just the vitamin C that we take, or the vitamin E, or the fish oils, but it's also the superoxide dismutase and the catalase and the glutathione that are in our cells. But as you get older, you have less of that. I like to tell people that intermittent fasting which, by the way, I wrestled through college. I hate it. I've cut enough weight, I don't need to do it anymore. But just to give you an example, when you burn wood, wood gives off heat. But as wood gives off heat, so it too gives off smoke. You can think of intermittent fasting as giving your mitochondria a break so they don't produce so many free radicals, which is the smoke of ATP production. So some of the big problems that I see with spinal cord injuries, and I just told you that inflammation can go on for decades, right? Not weeks, not months, not years, but decades. One of the largest problems associated with that is the fact that when you have inflammation, the myelin sheath, the white matter, breaks down. But if you look at the literature, the white matter secondary problems that are not just in spinal cord injuries, but in brain injuries too, stimulate those macrophages back to a pro-inflammatory status. It's like a vicious cycle. Of course you never get rid of the inflammation because the M2s are now M1s. And now they want to decrease the debris and get rid of it. But in doing so, the inflammatory cytokines go up. So you're getting more and more inflammation. You're not getting better, you're getting worse. How many people with spinal cord injuries go into the hospital able to move something, and then a week or two later they lose that capability? Secondary injury. So I started reading these data about rodents, and I hate to say it, so what I've had the benefit of doing is learning from translational medicine. Translational medicine is when we as physicians look at what happens in the animal kingdom. So you start things with rodents, and I read reports on dogs, and sometimes there's primate studies, non-human, that they do with monkeys, and we look at the changes that happen, and then we realize, how do we bring that to the clinic? How do we bring that dosing to the clinic? I've had the benefit of changing my dosing and going bench to bedside and bedside to bench for the last 3 years with Duncan Ross, who's a PhD. So I asked him about the cell biology, and he asked me about the clinical medicine. And back and forth we go, and we make some choices, and then we continue to move forward. When we looked at some of the stem cell studies with animals, and we looked at extracellular vesicles, which are essentially microvesicles or exosomes, and by the way, I want you to think of the two terms simultaneously the same. An extracellular vesicle can be 100 or 200 nanometers, and means it pinches off from the plasma membrane, or it can be an exosome, meaning that it comes from inside the cell, from the endosomal membrane. We have not clinically figured out the difference between the two. We lose. They both carry messenger RNA, microRNA, and proteins in a little plasma membrane shell. That's all you need to know. When they had spinal cord injuries with these animals, and they added these extracellular vesicles, they decreased the M1 microglia. Well, that's good. They increased locomotor recovery. Motor function is nice. They decreased hypersensitivity. Now, I've seen this in my own spinal cord and brain injuries, where neuropathic pain goes away, orthostatic hypotension, autonomic dysreflexia, and I think a lot of that is due to the inflammation in the central nervous system. And there's even improved overall outcomes. And in rat stroke model, they used mesenchymal stem cells from Wharton's jelly, and that seemed to work. And then they looked at neonatal ischemic brain injury. Does this ring a bell? M1s to M2s promote regenerative growth. I believe part of the thing that he's doing with that hyperbaric oxygen is not just decreasing inflammation, I think he's causing epigenetic changes. I believe that we're changing the DNA for the better. I do longevity talks for doctors, and I teach at a lot of these large conferences where I get doctors from a lot of different groups of practice, you know, physiatrists and anesthesiologists and neurosurgeons and orthopedic spine surgeons and now naturopaths and nurse practitioners, and they all come with different skill sets to bear on the practice of regenerative medicine. And one of the big ideas is that they want to decrease inflammation. Well, when I talk about longevity and we talk about exosomes, there's an intravenous play. We talk about intraperitoneal administration when I deal with autoimmune disease, because I want to dampen inflammation and hopefully turn back the clock on some of these cells as they get older and older. I believe in a unified hypothesis to aging and disease. I think by the time you're 35, 45, you've got oxidative stress, which means the cells are pooping out, but you can't see it in the organism yet. Then you come into my office and you're my age, 54, 55, and now your inflammatory markers are out of whack. Your CRPHS, which is a marker for heart disease, I know that's a risk factor for stroke. I can do ADMA, SDMA, lipoprotein, PLA2. We can do all kinds of inflammatory markers on you now. You still look okay though on the outside. And then at 65, well now the train comes unhinged, right? Now you get your heart attacks, your strokes, your Alzheimer's disease, your neurodegenerative diseases. I could have treated you at 45. But everyone told me and Dr. Harch that we were crazy 20 years ago because you can only treat allopathically once the wheel falls off the car. I don't think we have to. In this arena today, we're talking about treating retroactively, right? We're dealing with a problem and we're addressing that problem. For a lot of the people that come to listen to my lectures, I think it's treating it forward. By the way, when you have an anoxic brain injury, what do you guys think is the first cell in your central nervous system to go south? The oligodendrocytes. Two big problems with oligodendrocytes. It's like Tigers. You know, Tigers, I'm the only one? Well, in the central nervous system, there's one oligodendrocyte for every axon. And the oligos are the things that make white matter. They're like the Schwann cells in the peripheral nervous system. If you lose one, that's bad. And I just told you, if the white matter dies, that turns up your microglia, the macrophages of your central nervous system. We should be able to halt that. So you want to fix that, and that's one of the benefits they showed with mesenchymal stem cells. I think we're working in the same pew of the church. Funny I should say, listen, I'm a very bad Jew. My wife is a very good Baptist, and that's the only reason that I feel comfortable lecturing here today. So the question is, what makes sense? To me, we have to look at the administration scientifically. So when I started with regenerative medicine, people wanted me to pay 10 grand to come to their clinics to learn a protocol. It didn't make a lot of sense to me. I think James was greeted with the same, yeah, you come visit me, I'm going to show you how to do this. And guys were shooting 3 cc's of Wharton's jelly up their noses. I go, where does that protocol come from? Well, that's what we do. How many things in medicine is what we do? And you know what? The guy that taught me in residency did it, so now I do it, now I teach my fellows. And they're going to do the same thing. One of the biggest problems we make in medicine is the first thing we do is we read the MRI report. Now, I hate to read other people's MRI reports and CAT scans. I always like to look at the films because I'm jaded as a radiologist. I can't tell you how many times I pick up a report and the film and the two damn things don't match. And I can't believe that I'm reading this and this is this, and it doesn't recuperate what is actually on the films. It's not covered in the report. So these are the 3 ways that I started looking at these things and said, well, I can make a change. Intrathecally is into the cerebral spinal fluid. If you women have ever had a lumbar puncture because you were having a spinal at the time of childbirth because it hurt like hell, can I say that? Because it hurt a real lot, then what they did is they gave you anesthetics in the central nervous system to mitigate the pain. If you had a little one, they were in the ER, they may have stuck a needle in to see if the cerebral spinal fluid was infected. Now there's about 500 cc's of cerebral spinal fluid made every day. And there's 150 cc's at any one time. So you can give 500 cc's, it's okay. The baby won't die from that. Certainly more than 2 or 3 cc's they generally won't take on the little ones. Intranasal and intravenous. Well, these are routes that I can use, but what helps define how much, how to give it, and how often? So I started playing with the Afrin bottles. Looks funny, right? Because I bought them from China. Damn things work pretty good. And I realized, as an interventional pain doc, there's multiple ways that we can get in. We can get through the sphenopalatine ganglia. These are all injections, but they have limited volumes. And then I started thinking, well, some of these things can actually get intranasally right through the olfactory nerve. Well, that sounds easier because there's something known as the cribriform plate. It's interesting though. At the very top of your nose, there's a fenestrated plate. And I actually went to, everybody knows who Aubrey de Grey is, the guy that wants to live forever. He's a scientist, he does all those TED Talks. Well, I went to a lecture. I stayed for part of the first day. I missed the second day because I had a talk in Vegas. And they were talking about the cribriform plate. Well, at the very base of the skull is this plate, very thin bone. It's got little holes in it. And one of the theories for Alzheimer's is that as you get older, you sclerose the cribriform plate and it gets thicker. And as it gets thicker, not only can't you put stuff through this way, but stuff can't come down this way either. And what they found is, this seems a little archaic and odd, what they did is they put cement in the roof of some animals, right in the roof of the nasal cavity. And they watched them for cognitive changes over weeks and months. Do you know within a couple of months they were all walking around cockeyed, looking like they had Alzheimer's disease, with motor deficits and inability to reach for their food and such? The belief is that it's not just a conduit for things to go up, but if you had debris that you were getting rid of in the frontal area of your brain, it would leak out the cribriform plate and get into the nasal mucosa and waft away. And that's one of the ways we think we get rid of aggregate proteins. So there's tau and amyloid protein with Alzheimer's. There's alpha-synuclein in Parkinson's. There's TDP-43 in ALS. There's Huntington protein in Huntington's chorea. So these proteins get misfolded and have to get jettisoned out of the cells. But if they get jettisoned out of the cells and they just keep getting picked up again, it doesn't help. So for the people who walk into your doctor's offices and tell you that you're going to snort stem cells and they're going to get into your brain, I want to show you something. All right, well, on the right are mesenchymal stem cells intranasally and intravenously. Compare it to the MSC exosomes on the left. The red stuff is what got into your brain. Intranasally MSC exosomes, that seems to work pretty good. These are actually autistic mice, and the mice actually did better, but I'm interested in how the stuff got there. So intranasal outperformed intravenous. This was even more amazing to me, and it changed the way I treat some of my high cervical spinal cords. They showed in rats that if they just directed exosomes intranasally, they actually got all the way down to the spinal cord. That seemed to make sense. And then there was this study, and I spoke to someone here who's going to be unnamed, who I'm not going to single out in the audience at all, but we were talking earlier today about seizure activity. So status epilepticus is a problem in the hippocampus. And what happens is, yes, epileptic seizures won't burn out your brain. Your cells don't die of themselves. But when they spit out all the neurotransmitters, you get a tremendous amount of oxidative stress and inflammation, and that does have secondary negative effects. They looked at MSC-derived exosomes delivered through the nose of the animals, and within 6 hours, they reached the hippocampus. They increased inhibitory cells, but likewise, they also decreased the amount of inflammatory cells. And the neurons were even taken up in the cerebral cortex as well. They did another study, and they looked at abnormal brains. And they saw where the pickup was. If the brain was abnormal after intranasal administration, the exosomes in these mouse models, they were smart. It's not to say that the exosomes are so smart. So because the exosomes come from the parent's stem cells, and because they come from the plasma membrane of those stem cells, they have little protein markers in their walls, means they get picked up quicker. They also get picked up by phagocytic cells. If you have inflammation in your body and an abnormality, those phagocytic cells go everywhere. They go right to inflammation. They're smart cells. So even if I give it to you intravenously, and the exosomes, I know, go to the Kupffer cells, which are phagocytic cells in your liver, they go to your alveolar cells, or alveolar macrophages in your lungs, and then all these cells traffic over to the spleen. When you get another area of inflammation, they'll run out of there and go to the areas of inflammation. In healthy mice, there was no specific location that these exosomes were going to. Finally, some translational evidence that was making sense to me. By the way, any high school football parents? Yeah? It's safe, right? No concussions? No concussions, right? How old? 15, 17, and 18. There was a study done last year of high school football players between the ages of 15 and 17. No concussions. MRI kurtosis of the brain. They looked for changes before and after one semester of high school football. What percent do you think had changes? 100%. I'll show you some scary stuff for lacrosse players. I got one of those too. My point is, if you have unidentified bright objects on MRI and you have white matter changes, you have increased risk of stroke and sudden death also. So here I started looking at the intranasal literature in people, and I started trying to make sense of this. So if I want to deliver this stuff intranasally, how much do I give and how do I give it? Well, it looks like there's two modes of transport. There's intraneural and extraneural, inside of cells, around cells. I said, well, that makes sense. I could probably do that. And then I looked at the dose. The dose volume is 0.05 to 0.15 ml. That is not a tremendous amount of fluid, right? That's like an eighth of a cc. I'm sorry, that's an eighth of an ml. 30 mLs in an ounce. So listen, it's an eighth of an ml. So then I realized these little Afrin bottles shoot about 0.12 cc's. So if I do one or two shots, probably half is going to the nasal mucosa, half gets to the cribriform. I know in 6 hours it'll get to the hippocampus. If I do it every 2 or 3 hours, now I have an idea how to approach this. And I started approaching concussion that way and many other neurodegenerative diseases that way. So let's look at what I've done in the last 2 years. So these are the patients that I've seen that have got intrathecal exosomes. This doesn't include people that have had intranasal. It doesn't include people that have had 2 or 3 injections. I'm looking basically at people that have had either lumbar or cervical injections of exosomes. Many of the kids with autism and milder disease, I give them IV and intranasal. I like intrathecal because it goes directly in. And there's something known as passive diffusion that would suggest that only some of the exosomes should get into the spinal cord and brain. But it does better than passive diffusion. And one of the reasons I think it does that, just as they traffic when they go through the nose, they also traffic in the cerebral spinal fluid. You have to realize, where is the cerebral spinal fluid in terms of all the meninges? So when they teach you about the coverings of the spinal cord and the brain, there's the dura mater, which is outside. There's a potential space between that and the arachnoid mater. And then subarachnoid, the subarachnoid space is where the cerebral spinal fluid is that bathes your brain and your spinal cord. The only thing below that and the brain and nerve tissue of the spinal cord is a little peel membrane, very, very skinny. It's easy to believe that if it goes into the cerebral spinal fluid, whether it goes in through here or directly through here, or the low back, it's immediately essentially bathing all those neural stem cells. So when I look at my last 2 years, I've got more spinal cords than anyone in the country. I've done 33 of those. I've got a fair amount of Parkinson's, MS, dementia, stroke, and there's some anoxic brain injuries both in adults and children. By the way, it works very well for Parkinson's. I've got one guy that came in really limping on a cane, and after one treatment at 4 or 5 months, he was able to jog and catch footballs. Very odd. And he decreased his dopamine by half, which is one of the reasons that I think this will work for drug addiction. I had a stepson that I lost last year from drug addiction, and thought he was doing well, and the problem is there's always that desire to reach for drugs. And one very interesting aspect of this is that drug addicts have a very dopamine-impoverished brain. They have decreased dopamine receptors, and they secrete a decreased amount of dopamine. This stuff works in Parkinson's because it's clearly upping the dopamine. Many of my Parkinson's patients, from 40 to 60%, they've reduced their dopamine. So I think there's a play for an intranasal with those kids. So here's Chico. Now, I can't get my pointer to work, but just for those of you in the audience who haven't read MRIs before, Chico is from LSU. He was a cheerleader. He stayed on to become the cheerleading coach. 7 years ago, he had a horrific boating accident. Now, one of the things he had is autonomic dysreflexia. And what you see in a lot of these spinal cord kids is they have a very hard time regulating their blood pressure. and they go orthostatic, meaning when they sit, they drop their BP. And they take sympathomimetics, drugs, in order to elevate their blood pressure, to try to keep them at normal pressure so they don't pass out every time they sit up. The gray area inside the white is the spinal cord. I can't see. Is there one of these that'll work? Oh, let's see. No. All right. Well, the gray, you'll see the gray sort of interrupted, and then there's gray again in the middle of that white track. That's the spinal cord. And although it looks like a complete disruption, we could argue that there may be some filaments of spinal cord on either side of that. Now, this gentleman has an ASIA A. ASIA scale is how we grade the spinal cord injuries. A means below a certain level, below C3-4, there's nothing. Very little motor, very little sensory, no bowel or bladder, no sphincter control. Generally, the worst things to come back from. So I give him an intrathecal injection. You can see a needle on the second photo coming at the base of the skull into the area, I wish I could show you this, the white at the base of the skull on the other side. That's known as the cisterna magna. Now in older people and kids above a certain age, I'll do this because I can rule out that there are no abnormal blood vessels in the area. Can we run these? So this is about 3.5 weeks after that, after spending 7 years in a wheelchair. Now I will tell you that if you diminish the inflammation in your central nervous system, some of these nerves will fire. And you can hit the other one as well. More importantly, he's been on Midodrine 3 times a day for 7 years. Within 5 days, he stopped taking the Midodrine and now sometimes takes it once a day. So some of these kids are progressing far more. Go to the next one, please. And you can hit some of these. He's actually getting some hip flexor at 8 weeks. And he's getting some hip control right there too. So slowly these things happen. And you parents have to have faith. Everything doesn't happen immediately at once. It ghosted us, huh? That's all right, we got some more kids. So, I don't know if anyone remembers this. The Butterfly Effect was a very powerful film. And it talks about the things that happen in our lives and sometimes how a singular event can have such a pronounced change on the full trajectory of our lives. And that something that happens in a moment's notice, in his film, one little iota of change changes everything. And so much of it is that way for our kids, right? We have, suddenly they have an anoxic injury, or they have an unusual brain injury or a spinal cord injury from a traumatic event, and like that, life changes. Well, sometimes we have the ability to change things for the better, much the same way as the butterfly effect. This is Tommy. Tommy's a 16-year-old kid who's involved in an ATV accident. And again, it's another ASIA A. Tommy's a little different though. Tommy is from the prestigious Cleveland Clinic. And so, the simple doctor from Yonkers, New York, has to call up the Cleveland Clinic in order to get approval for a medical clearance to put Tommy on the table. And who do I get? The most prolific, well-written physiatrist in all of clinic history that's written all the textbook. She calls me a heretic, a liar, a cheat, a couple of other things that I won't mention in the church. And she says he's going to spend the rest of his life in a wheelchair. He better get used to it, you better get used to it, and stop lying to his parents. I go, listen, I think that there's a possibility of benefit. I think he has a chance of doing something and maybe standing and walking someday. Won't you at least give him the chance? Who am I to play God? And she ridicules me for about 15 minutes, and you'll notice that on the bottom left, his hip flexors, his knee extension, tibia, every muscle group below the hip is a 0. And you'll notice in the middle of that picture on the left, there's a big white doohickey. That is a replacement in the central nervous system spinal canal where the spinal cord itself has fluid instead of cord tissue. Now, by the way, I've done a couple of these, and I have one that's actually had serial MRIs that shows the fluid-filled cavity on one MRI about 40–50% decreased in size. I'm going to wait for another year after another treatment or two and see it again to see how much it changes, and then maybe I'll have some decent results to show as well. Anyway, here's what's important. We talked about the butterfly effect. Before you run this, Tommy has some mild benefits for the first couple of months. Very mild. Tommy gets to about 5 months and starts crawling. I want to show you what happens at 6 months after one injection. Can you run some of these? It's a great trick. Maybe if you turn that one off, you can run one of the other ones. Well, Tommy was walking. You'll have to take my word for it. Kind of a liar and cheat, am I? Tommy's got it. Is that it for Tommy? No voice from above? We're in a church. No, that's it for Tommy. All right, we'll go elsewhere. All right, so here is a boating accident in a spinal cord injury, 19-year-old male. Had prior stem cell injections with some benefits. He actually came up to me because the parents wanted me to do an intrathecal injection. He had some improvement after the first ones, but we were going to do exosomes intrathecal in the cervical spine at the very top. He's been injected by me now 3 times, either at the C1-2 or the occiput C1 level. That's a picture of what it looks like at the C1-2 level. And can you run some of these without them disappearing? Boy, talk about anticlimactic, you two. Don't worry, the pressure's not on me. They don't want me helping them up there. So anyway, what I wanted to show you initially is the first one. It doesn't show a lot of good truncal tone. But after his second injection, let's try here. Can you run this one? All right. I guess we can go elsewhere. We'll try another one? All right. Here's Paul. Paul is a spinal cord injury C4 to C6 in Asia C, but although he's in Asia C, he's got very little movement in the legs. He had allodynia, which is painful to touch. You can't even touch him without him getting very, very upset. Lots of spasticity and tremors, problems with bladder catheterizations. So Paul doesn't trust me. Paul says, well, if you can grow my hair, maybe I'll let you play with my spinal cord. This is true. This is this kid. I love this kid. So 5 weeks later, he looked a little bushier. He goes, all right, maybe you're legit. I'm scared to ask for this. But, oh yeah, oh yeah. And then the one on the right is the first time Paul stood. Oh yeah. He now is converted to a standing wheelchair after only one treatment of mine. He did get another treatment on the West Coast. I don't know how he's doing. But he's able to stand in his wheelchair for an hour and a half. And again, somebody that couldn't do that before, he's got some quad strength and some hip strength. Name the sport. Lacrosse. 2 C6 spinal cord injuries in lacrosse players. I didn't think it was possible. As soon as I saw this, the second kid walked in. I called the first kid's parents, and then I called my son's professional lacrosse coach, and then I called every football coach and every lacrosse coach that I could touch. Both kids did the same thing on impact. They tell you to tackle head up, both kids did this. Just that. Just the fact that they dropped their chin on impact caused their head to act like a piston and fractured the C6 vertebral bodies. And both vertebral bodies went back into the spinal cord. So Jack's a good kid. Jackson Asia D, C6 spinal cord fracture. He's been treated a couple of times. So this is a note from Jack's mom. After December, he'd been able to stand with assistance. 3 months later, if you can see this, or you have to take my word for it, he walks without assistance. That's what we're aiming for, right? We're aiming to get kids walking. Every step of your child's benefit, you have to have, quantified goals. So I have Livy now, who had a C1-2 spinal cord injury, came and saw me, and this was actually in the Washington Post maybe about a month ago. And again, not the greatest write-up, but that's what the media does to you, right? They're not lovely. And she's been on a ventilator for a number of years since her car accident. So now she's off the ventilator, and she's able to breathe on her own for 10 minutes. And she said, Doug, she called me up on Friday, she says, my oxygenation is still 95% on room air. She says, but I get lightheaded, I get nervous, they put me back on. I go, is that because you're hyperventilating, you're so nervous? Start breathing through your nose and breathe in through your mouth. So she may actually be able to get off the vent. The idea for her is to inject, I had to inject her in her wheelchair, bending forward with the vent. The next step, if I get her off the vent, I can lay her on a table and maybe put it just below the base of the skull. So there's Jack. Okay, here's Sean. Any of your young kids take vacations out of the country? 19, 20, yeah, right? Sometimes 20, 21. He's one of the two Seans. It's actually pretty funny. These are really good kids. And they live in Florida, and I mean, they're what normal 21-year-olds do. They both drive their cars, and they pull them up to the bar together, except both of these kids use hand controls, and they take their wheelchairs out, they flip the switch to valet, flip the valet guy the keys, and both guys go rolling into the bar together. And they're both 21 and 22. So this young gentleman, we're trying to get him to use his legs. He's an Asia A T12. So T12 is down here, but Asia A means he can't use his legs. But in his trip outside the country in the Dominican Republic, he's on the 3rd floor balcony. And he says, well, that balcony over there doesn't seem that far. And he doesn't make it, and he lands on his head. And he gets a basilar skull fracture. But one of the interesting things is anosmia, so he can't smell. So one of the benefits that we gave him with the intranasal is that his smell came back. Right? So we replenished that olfactory nerve. He also couldn't move his hips at all, 0 out of 5, meaning he can't swing his hip. In order to walk, when you get to that level, you've got to be able to swing the hip and lock the knee. Swing the hip, lock the knee. So people will work with these kids with brain and spinal cord injuries to try to do those things. And there's some really great places throughout the country. There's Push to Walk and other things. And believe me, if I treat you, every one of these parents is being told that they should get hyperbaric oxygen. 100%. 100% would benefit. People ask me when? Within 3 days. If you get a lumbar puncture or cervical puncture, I prefer that you don't fly for 3 days, because if you're going to get a dural puncture headache, 3 days. I don't worry about things trafficking to the sites that I want them to go to, because I put them in your IV, they'll be in macrophages, liver, lungs, spleen within 6 hours. If I put them in your thecal sac, within a day they'll probably have located. You just saw 6 hours going to different areas of the brain and the hippocampus, right? But the 1 week link is if I put a hole in your dural sac and you have a fluid leak and you go fly, or I put you in hyperbaric oxygen, that may change some of the parameters. You may get a worsening headache. Certainly if you fly at 35,000 feet where there's no pressure, you may get a worse leak. So those are the only parameters, 3 days. Earlier is better, just like an injury. If I get you earlier, also better. So right hip flexion 0, goes to 2.5 to 3 out of 5, left hip flexion. He gets more feeling. So we see visceral changes. You know, I do autism also, and people ask me, Doug, what are the changes going to be? So I've seen improved cognitive function, decreased repetitive behaviors, decreased verbal behaviors. I've got one kid that used to eat 20 Slim Jims at a time. So he would go into the pantry and eat 20 Slim Jims. So I looked at it, I go, there must be a weird satiety center, and there is. The ventral medial hypothalamus has a satiety center that must have been inflamed. After I treated him, not only did his epileptic seizures go down and he came off his meds, but he stopped eating after 1 or 2 Slim Jims. And his mother said, that is a success. So this kid, some of the sensory changes he sees, pressure sensation in his right buttocks improves, his right thigh gets a new sensation zone, right front hip pain, left hip. He's got huge improvements in smell. Okay, we can run some of these. Oh, you're going to be able to see the hip flexion. Okay, bring the hip up. That's a boy. If you can bring the hip up, you can. Oh, we skipped him. There should be another one with him walking. All right. Where's my little Burke?
Right here. She's laying down. She's not working.
Okay. So Shelly, raise your hand. That's my girl Shelly. Okay. So Shelly and Don take care of little Burke, and that's their little baby. So this is something Shelly wrote to her husband that I shared. He was nice enough to share with me, and I asked her if I could share it with all of you. One of the best things that I could possibly do would be to kickstart the cells of your body so that they'll be more amenable to hyperbaric oxygen and vice versa. Exosomes are going to upregulate the stem cells in your neurogenic niches. Those are the areas of your brain that there are cells that are almost neurons and almost glial cells. So whereas she didn't do great with hyperbarics a year and a half ago, if we can get her into hyperbarics now, I'm sure she's going to show benefit because of all the benefits she showed already. None of us should be practicing in a vacuum. That's the biggest problem with medicine is we come in and say, only my stuff works. It's not true. If I was a parent, I would use everything in my armamentarium to get my child better. But you got to be smart about it. Doesn't mean you're going to fly here, there, and everywhere else. You got to understand the science, wrap your head around why it's working, and get to the next step. Here's another drowning victim. This young lady is in New York and lives in Staten Island, and she's had 2 treatments. And now she's starting to reach for toys, holds her head up and sits up. For fear of showing you any movies, no pressure upstairs. So, what do I like to see with these things? There is a friend of mine on the West Coast that uses actually acoustic brain waves to open up the blood-brain barrier, and actually uses something known as brain sonics after doing functional MRIs. What was that? You're looking lovely, thank you. So there are other things you can use to upregulate stem cells. Certainly hyperbaric oxygen works very, very well. People have proposed using spinal cord stimulation. I have a PEMF unit. I don't have hyperbaric, I send everyone out. There's a center up in northern New Jersey that does hyperbarics. So in closing, there's too many works that I can cite, and there's been a lot of things said. The best thing I can tell you is for the last 3 years, I've changed the focus of my practice. So I still do interventional pain, but I do a fair amount of regenerative medicine. And thanks to Dr. Harch and Mr. and Mrs. Carlson, it opened up my mind to start treating many of the things that I didn't think were possible just a few short years ago. And as parents, you should all realize that we don't limit the benefits of our children. That's up to him. Best thing we can do is keep trying.